Hello and welcome to TAA Conversations on Art and Peace. I'm truly honored to welcome our guest today, Christopher Bailey. Christopher is the Arts and Health Lead at the World Health Organization and co-founder of the Jameel Arts and Health Lab. What makes Christopher's journey so compelling is his unique path, from professional actor and playwright to a global leader in health. He studied at Columbia and Oxford universities and at the American Academy of Dramatic Arts. And he's brought that artistic foundation into his work at the WHO. Through initiatives like the Healing Arts Campaign and the Jameel Arts and Health Lab, Christopher has helped shine a global spotlight on how the arts can support not just individual health, but collective well-being, physical, mental, and social. His work beautifully aligns with the mission of the Art Association to encourage peaceful engagement through art in all its forms. Christopher, thank you so much for being with us today.
My pleasure.
And I'd like to jump into the first question. Christopher, could you share your path from being an actor and playwright to leading the arts and health program at the WHO?
Well, I'll try to be brief because that's I could talk that's decades of life trying to squeeze it into a couple of minutes. I mean, just to be clear, I was never a famous actor. I was a professional actor, and I got some gigs here and there. But I never earned $1 million. I was recognized in the street a few times. Uh, People would come up to me and say, "Hey, aren't you the guy whose head exploded?" based on a science fiction film I had done when I was young and foolish. But essentially, the short version is after a few years of being a professional actor and starting a family, I began to realize that, children need to be fed and clothed and often every day. So I needed a more reliable income. So moving into a different career path was a financial necessity out of parental responsibility. And I found myself working in a market research company. And one night at 2 in the morning, I woke up absolutely petrified, shivering in my sheets. And I was anxious about this market research report that I was responsible for that was due out the next day on the US market for dog food. And I thought, oh my God, I am literally losing sleep over selling more dog food. A few years ago, I was playing Shakespearean Kings on Broadway, and I where has my life gone? So that Sunday, I went to the New York Times and I looked in the Help Wanted section and I saw an ad for a research professional for a global philanthropy. It turned out to be the Rockefeller Foundation, and I became the research manager. And from there, I was recruited to WHO, where I originally signed over 20 years ago to help develop a knowledge management strategy for the organization. And one of the first assignments I had was to help with the 3x5 program, which was a campaign 20 years ago to try and get 3 million people living with HIV in Africa on antiretrovirals by 2005. And what I found is that coming in with techniques and technology into these rural African HIV clinics that were already overwhelmed with the task that they had to achieve, more often than not, I would be received with a pleasant smile, a nodding of the head, and an incredible amount of patience waiting for me to leave. Um, so rather than coming in as a salesperson with solutions, I came in with a theater technique. I used Augusto Boal's Forum Theater from his book, Theater of the Oppressed. And we, instead of saying, here's the solution that will help you, in some ways, cast a play. I didn't tell them that it was a theater technique, but it was. And rather than providing a solution, I provided a half-written script that they then became roles in, and we created the ending together. We literally created the solution together, and it happened to be an open source electronic medical record system called OpenMRS. And so the result was not just a sense of ownership from the clinicians, but it was actual ownership because it was open source and they developed it themselves. And so years later, when Dr. Tedros had become Director General and he put out his famous call to staff for crazy ideas, I began to reflect on how I was using theater and artistic techniques in my health technical work in the field, and also how I was trying to include health and development themes in the theater company I was helping to run evenings and weekends in Geneva. And I thought, hey, why don't I just propose arts and health as a new program? And I did, and he accepted it. And that was the beginning of the story, really.
That's amazing. Just amazing. So, what are your main objectives as the World Health Organization's art and health lead? And how do you see this field developing globally in the years ahead?
Well, when I travel around the world, working with, listening to arts and health professionals, there's lots of innovation that was already happening, that is happening as we speak. But much of it is isolated. It's developed locally, which is good, but doesn't necessarily get to scale and doesn't necessarily get to all of the populations that are in most need of it. So, in terms of our goal is to try and measure through robust studies and trials effective arts-based health interventions and their scalability, particularly to underserved populations. That's really the goal. And to achieve that, the other research component of it is looking at the basic science, looking at the biochemistry and the neurology and the medical anthropology of why this works, what's the mechanism. And that's to me where it gets really interesting.
Yes. And could you share more about the Healing Arts Initiative and its impact?
Well, the healing arts, they're basically, it's part of a larger uh, effort that I created with partners at NYU and WHO Europe and a group called Culture Runners called the Jameel Arts and Health Lab, which is a consortium of research centers around the world looking at the evidence base for the health benefits of the arts. But the Healing Arts campaign itself began during the pandemic, and it was a way of helping galvanize isolated communities through online events. But we also had an opportunity to work with Christie's Art Auction House, who had volunteered to auction donated paintings where the proceeds would go to artists who were negatively impacted by the pandemic. And and even though at that stage they were entirely virtual because of the lockdown, they still sort of held to these city auctions that they do around the world. So to promote those auctions, we did these online conversations and activations. And as the pandemic eased, we found that they were so popular that cities around the world began to ask, can we do an activation in our city? And so the auctions stopped, but the promotion of them, these events continued and began to grow in size and complexity and intensity, so that now we do three or four of them in major cities around the world, and even sometimes nationally.
Mhm.
And they've really taken off.
Wonderful. And how do you see the arts supporting physical, mental, and social well-being?
Well, I think that separation of physical health, mental health, and social well-being in some ways is an artificial separation. I think if one of those areas is impacted, it negatively impacts the other two. If I am physically ill or wounded in some way, I'm going to be depressed about it. I'm going to have trouble interacting socially. And conversely, if I'm depressed, it's going to affect my physical health and my social well-being. If I because of my social setting, I do not have access to health care. I am more likely to be in a dangerous job. Those are social determinants that affect my health. So I think with the arts, because it's such a holistic enterprise, you can turn some of those vicious cycles into virtuous cycles where by working in the arts, instead of focusing on the reduction of a symptom or a disease, you begin to use creative expression to cope with the everyday stresses of life, to practice your abilities to their highest degree, to become more productive, to contribute substantively into community, to acknowledge moments of joy, regardless of what diagnosable condition you may or may not have. And that can be a very, very powerful journey where it becomes not so much about curing a condition, it becomes more about curating the narrative of your own life, taking agency over it, regardless. So if you have a condition and you're able to find a personal, authentic meaning in what is happening to you, first of all, you're liable to lower your stress levels and become more receptive to physical, mental, and social healing. But even if you are not healed, even if it's a chronic condition or a fatal condition, to have the opportunity to create an authentic personal meaning, even in a misfortune, is a tremendous gift, and it's something that uh, is part of what really makes us human.
How do you see community-based arts contributing to healing and reconciliation, especially in divided or post-conflict societies?
Well, I think arts and conflict are um, a really interesting subject. First of all, one of the reasons why I like the arts is that instead of uh, imposing a worldview on people, the arts actually embrace doubt. They embrace conflict. You can't have a play without a protagonist and an antagonist. You can't have a painting without light and dark. You can't have um, music without a progression through major and minor uh, keys and loud and soft. Contrast and conflict and resolution are part of the artistic experience, and they actually affect us neurologically to find pathways through conflict or to prevent conflict. Um, I'll take sort of the alpha and omega of it. On the prevention side, there are a lot of interesting studies in arts programs in prisons. And one of the things they're noted for is the very low recidivism rate. And why is that? Why is it that prisoners who often have experienced trauma themselves go through these arts programs and don't repeat the same behaviors that brought them back to prison in the first place? And I believe part of it is because the arts has a role in healing and reconciling earlier trauma. And so when you are then faced with the triggers that created that fight or flight reaction that got you into prison in the first place, the arts offer a perspective, a way of being able to find a third alternative that is not fighting or fleeing, but is engaging. And that's more than just a choice. That's actually a neurological change. And so it has a prevention aspect, which I think is very important. But there's also this healing aspect that I alluded to. And I think what it comes down to is that when you experience an extreme adverse event, a traumatic event, uh, you have a moment of dissociation where something is so negative that it's almost like your spirit leaves the body. You become disconnected to yourself, to your relationships, to the world around you, even your sense of time. The arts literally is about reassociation. It's about connection, rebuilding. So, in those cathartic moments of discovery, of awe, instead of when you're in the presence of something intensely beautiful and larger than yourself, instead of feeling diminished, you recognize that you are a small but essential part of a larger whole. And evolution rewards that revelation with a shot of oxytocin, the bonding hormone, which literally allows you to reconnect to yourself and to the world.
Hmm.
So it can have such a powerful effect in recovery from conflict and finding a personal meaning in it and finding a way back into society. At the end of the day, WHO sees the arts through a health promotion frame. It's there to assist each of our individual and collective journeys into finding a personal sense of meaning in our lives and a sense of belonging. And those are essential human objectives. That's part of the definition of thriving and of human happiness.
Well done. Unbelievable insight. Greatly appreciated. Would you be willing to share how art played a role in your own healing journey?
Well, yes, there are a number of things I suppose I could talk about, but for me, when I lost my sight, I felt dare I say it, disconnected to the world quite literally. I couldn't see it anymore. And in a way, in our current society in particular, 80% of the way we engage the world is visual. So when that was lost, I felt exiled. I felt in some ways pariah. Um, and although I continued to do my work, I continued to function. Um, my sense of enjoyment of the world was drastically diminished. And although I learned to use a cane, I learned eventually the neuroplasticity of my brain kicked in, and I developed the ability to echolocate, to navigate through sound, the way sound reflects and refracts from the physical environment around me. I was able to create a kind of a visualization of the world through sound that helped me get from here to there. But it didn't really make me enjoy the world that much better. And it was a moment where I was in London and I was trying to get to a concert at St. Martin in the Fields. And I was crossing Trafalgar Square in the middle of a crowd, and because I can't see, I got disoriented. The crowd began to buffet me back and forth, and I felt my heart racing, and I began to sweat, and I realized I was having a panic attack, and eventually this human wave washed me ashore on the wrong side of the square, and I found myself in front of the National Gallery. And my heart sank because I had been avoiding museums because, frankly, they had given me so much pleasure. I couldn't face looking at these paintings in the polluted state of my vision. But I went in anyway just to escape the crowd. And I found myself in this giant gallery with these monumental paintings. And I'm looking at them, trying to figure out what they are. And I'm with my 5% foggy vision, I'm perceiving um, ghostly ships and clouds and storms and fog and mist and waves and sea spray. And I'm realizing I'm in the Turner wing of the gallery. And then suddenly I felt something on my cheek, and it was salty and wet, and I thought, is this the sea spray from the painting? No, it was the tears streaming down my face because through the interaction of this long dead artist, the object he created, and my own personal story and experience, I saw that the way Turner saw the world was identical to mine with my terminal glaucoma. And for the first time, I could recognize, I could actually conceive that the way I see the world could be conceived of as beautiful. And that was the beginning of my transformation.
Thank you for allowing us in on that. That is just an amazing transformation. So, what is your vision for how the arts might be integrated into global health policy and public health practices?
Well, I think right now I am working with a number of member states on uh, different policy frameworks that could help with creative expression as part of the health system. And the UK, for instance, has innovated a practice called social prescribing, which is a bit of a misnomer, but it's the essential idea is that when a patient comes to a general practitioner, uh, instead of immediately prescribing a drug or something like that, if there's an opportunity to address the person's needs with an artistic activity or being in the countryside or some sort of social activity, they're then referred to a link worker who actually has the time to sit down, get to know the person, their tastes, their pleasures, their objectives, their needs, and design a program that can help them integrate to people, to arts practices, to whatever it is that turns them on. And so to create a framework where this can be done at scale in a financially sustainable way that actually saves the health system money and helping provide the evidence of that so that it can be passed is part of our job. Just to take one example, for instance, and we've had some successes. There have been a number of in the US, for instance, some bills proposed at the state legislature to have arts therapy paid for by state health insurance, which had never been done before, and a number of different policy successes around the world. But there's plenty more to do, and I think part of the dialogue is just simply to expose policymakers to the evidence, to the potential of this work, and then provide some tried and true templates of how this can be done at scale.
And lastly, what message would you like to share with TAA's international community of artists for peace?
Well, I think the real message of the whole arts and health movement is one of agency. There are many things that happen to us in this world that we have no control over. Um, but each of us, individually and collectively, um, do have some control over how we interact with each other and how we share our experience in our lives. Um, I go back to a quote from Thomas Jefferson, who said, "If I light my candle with yours, your flame does not diminish, but together we make the room that much brighter." The world is not essentially a transactional enterprise. That is a myth. That is a system that was developed to create a social economy. It is not a universal truth. The universal truth is that um, the quality of mercy is not strained. We the truth is what we give reflects back on us and to our community uh, manyfold. And that's something I think we should all keep in mind that the good that we do lives on and multiplies.
Christopher, thank you for sharing your insights and experiences with us today. Your work reminds us that healing isn't just about medicine, it's also about meaning, expression, and connection. You've helped make the case for the arts as a powerful force for health and peace. On behalf of TAA and its members worldwide, we are grateful for the work that you are doing in furthering peace through art and look forward to following your continued impact around the world. Thank you very much, Christopher.
My pleasure.